this bill. As I stated in my debate of this bill in the House, where it did pass, if the hearing impaired want and need quality safe sign language interpreters, I, who can hear, will not oppose their request. House Bill 149, contact lens minimum prices. This bill prohibits manufacturers of contact lens to set minimum selling prices. 90% of all contacts are manufactured by 4 companies, one of which is Johnson & Johnson. This bill was supported by Walmart, Costco, Fred Meyer, 1-800-CONTACT, and other price-conscious retailers. One of the manufacturers in a reported optometrist seminar actually admitted they had set the minimum price so that their contracts could be sold to help the optometrists capture more of the market. In other words, so the optometrists could not be undersold. They tried to compare their pricing to Apple, which has a minimum price on many of their products. The difference is there's a federal law that states when an optometrist or an ophthalmologist does an eye exam and prescribes contact lenses, you have to buy that brand that they prescribe. You cannot change brands unless they prescribe them. How do the manufacturers have their thumbs on their retailers? If the retailer tries to sell contacts at less than the minimum price, the manufacturer will stop selling their contacts to the retailer. The discount retailers, therefore, for example, cannot sell 2 pair for the same price or sell a year's worth of soft lens contacts for less than they sell a pair for 1 week's worth. There was a class action suit by approximately 32 states in 2007 that apparently went all the way to the Supreme Court because the manufacturers tried to fix their prices. The manufacturers did lose that. The minimum price plan might be somewhat different, but certainly not in results to the consumer. Again, the federal law that states you cannot change the brand of contact prescribed by your optometrist, and now that brand has a set minimum price, is the challenge free trade factor here. Well, Wayne from the Idaho Freedom Foundation was happy with me on a cottage food home kitchen bill that came through. I was the only one on committee that voted no. There was a very simple House Bill 106 that exempted home kitchen operations from licensing requirements for food establishments. I was on board for that bill so those home kitchens could sell their cupcakes or other home kitchen food products without being licensed or being inspected by the Health and Welfare Food Safety Division. Unfortunately, the Food Producers of Idaho legislative team got a hold of it and made it into House Bill 187, which added all kinds of regulations and registration for the home kitchen entrepreneurs. The Food Safety Director for Health and Welfare stated his department has never tried to regulate or go after the home kitchen sales. He said with House Bill 187, we will have to increase the size of our staff for the increased regulation. Again, I was the only one who voted opposed to the bill, but the co-sponsor representative actually wound up dropping her sponsorship after she gave it more review. It has not gone to the House yet for a vote. Lastly, certainly a benefit of the Idaho Freedom Foundation as well as the Idaho Farm Bureau is that I have another research process in making my decision to vote for or against a new bill, with me still making the final decision. I've had 5 bills so far that I've presented to the House, 4 of them this week. House Bill 142, a planning and zoning bill regarding minor board changes under certain conditions, brought to me by the Association of Counties. House Bill 179, a bill to help Kootenai Health Hospital and other county and district hospitals better manage their idle funds with A-rated bonds, the same as the Idaho State Treasurer is allowed to do. Senate Bill 1081. Again, the Senate bills go to the Senate, then they come to the House and have to be approved through there. A bill to replace the surplus reserve dollars required in a self-funded health care plan. So it's back to the prior 2013 surplus requirements. This amended bill is limited to Idaho's 4 public universities: University of Idaho, Idaho State University, Boise State University, and Lewis Clark State College. This amendment is very important for the University of Idaho so that they do not tie up more of their unrestricted reserves required by the regents and used by the bond rating agencies. That did pass also. Senate Bill 1037. What I thought was a simple bill having to do with dental hygienists and dentist licensing, renewals, expiration, cancellation, and reinstatement requirements. My first presentation actually wound up in a tie vote, 32-32 in the House. Why? Because one of the representatives debated strongly against the 30-day time period being too short for a cancel the license. Before that day's session adjourned, however, there was a motion by that same representative that was against the bill to reconsider it so we could come on the next agenda the next day. He did believe he saw there was another notice in the bill. So the next day in the House session, my bill was brought up again. But the same representative was still opposed to it. In my debate on the floor this time, I was able to answer many of the other representatives' concerns because there actually was 65 days from renewal notice to the cancellation. And the cancellation only happened after a 30-day grace period with a certified letter. The Dental Board and Dental Hygienist Board had actually brought the bill to the committee and were in favor of it. So it did not make any sense to me why someone not in their industry would reject it. It passed by large majority this time. My bill was the second bill sent to the floor for reconsideration in this House this term. However, the other bill that had been sent under for reconsideration failed to pass on the second vote. I thought the dental bill was going to be very simple, whereas my self-funding, very complex bill that took more explanation passed unanimously in the House. I have learned when you present a bill on the House floor, you must be ready for any question with a logical and honest answer. These aforementioned bills were brought to me to present to the House, since a representative has to present any bill before the House. I also co-sponsored House Bill 089, a Second Amendment constitutional carry bill, which unfortunately is still held in committee and may not come out. I co-sponsored House Bill 153, a community health emergency medical service bill. Representative Luke Malek brought that bill to the House floor, and it passed and was sent to the Senate. That bill actually originated by the EMS and First Responders Organization. It began from a pilot program done in Ada County. This bill, for example, would allow an EMT to do a home visit for a senior just out of the hospital to confirm he or she has been taking the medicine prescribed to keep the senior in better health or even alive. Thusly, that senior would not wind up in the emergency room of the hospital again. By expanded EMS training, the EMT and an additional physician assistant can be used in more community health areas, not just emergency care. The payment for this service could also come from the hospital, an insurance company, or other non-taxed payment programs. Well, that does it for my thoughts on the bills that originated in my committees from this last week. I pray God will bless you and your family and our lovely state of Idaho. And friends, neighbors, constituents, we still need much prayer for our nation. Thank you.